I'm Dr. Jeff Tyson. I'm an interventional pain management physician with Sound Pain Alliance. I'm also board certified in anesthesiology and addiction medicine. We are putting this video together for our Sound Pain Alliance patients who are considering being started on or continuing chronic opioid therapy in order to inform you of the risks of chronic opioid therapy. Opioids are a class of medications that we use for treating patients with pain problems. The common characteristic of all opioids is that they work on the same receptor on your cell called the mu-opioid receptor, and that's how they give you pain relief. The opioid receptors on your cells are also responsible for some of the adverse side effects that we can see and are associated with the risks of being on chronic opioids. The opioids that we prescribe can differ in the types of molecules that they are, the method that they're delivered, things like onset time, half-life, or duration of the medication itself, but they all have the common pathway of working on the same receptor on your cell in order to give you pain relief, but also potentially give you side effects. When we prescribe opioids for a patient, we are worried about two major risks that can develop on opioids. The first one is a life-threatening overdose. With an overdose, what happens is you take more opioids than your body is used to, and that can cause a slowing of your breathing to the point where you can end up with organ damage like brain damage or even dying. That's essentially what happens with an opioid overdose. The other major risk associated with opioids is the development of opioid substance use disorder, or what used to be called addiction. We use the term opioid substance use disorder now because it doesn't have the same social stigma as the term addiction does, but that's also a major risk of opioids and one that we worry about. About 80% of the population can safely take opioids without the risk of developing addiction. It's largely tied to a patient's genetics. Addiction is a genetic disease. It's very important to understand the distinction between opioid substance use disorder, or as we call it, addiction, and the phenomenon of physical dependence. Physical dependence is a property of the medications that can arise in virtually any patients who are prescribed those medications. Physical dependence is defined simply by the fact that if a patient abruptly stops the medication, there are withdrawal symptoms associated with that medication cessation. Virtually 100% of patients on chronic opioids for even a relatively short period of time will develop some physical dependence on those medications, meaning that if they stop the medications abruptly, they can suffer some withdrawal symptoms associated with that. Those may be mild, they may be very severe. It really varies from patient to patient. That is not addiction. Addiction is defined by an obsession to engage in the behavior, loss of control once the behavior starts, and continuing the behavior despite adverse consequences. So the definition of a use disorder or addiction is a behavioral definition. It has nothing to do with the physical properties of the medications themselves. Physical dependence, on the other hand, is a property of the medication and the physiological effect it has on patients when it is suddenly stopped. While these can be uncomfortable for certain patients taking them, they're not the kind of life-threatening complications that we worry about, such as respiratory depression or the development of addiction. When we prescribe opioids, we try to do so in a manner that is the safest for you as the patient, but also taking into account safety for the community and safety for ourselves in terms of following state and federal guidelines in the way that they need to be prescribed. As part of that, we have an opioid pain treatment agreement, which very explicitly outlines the expectations that we have of you as a patient in order to be successfully treated with chronic opioid therapy. These expectations are things like having urine drug screens periodically, possibly having pill counts. If we do get concerned that you are developing behaviors that can be associated with substance use disorder or addiction, we may request that you go in for an assessment from an addiction medicine specialist. The items in the pain treatment agreement are designed to provide the safest quality care that we can to you as a patient and make sure that we are adhering to the state and federal guidelines around chronic opioid prescribing. If we see violations of the pain treatment agreement, we will assess those on an individual basis. Depending upon the violation and the patient's history, that may leave us in a position where we're unable to continue to prescribe chronic opioid therapy for patients. We treat those violations on an individual basis and assess them just like we do all our patient care on an individual one-on-one basis, taking into account the patient's history and risks and other psychosocial factors.